Welcome to On Point. We're live on TV and live on Facebook for Monday, November 18th. Today we're talking health and safety in the workplace. A lady that's been doing this for a long time, Louise Tet, joins me right after these commercial messages.
Recently, the Government of Ontario established a $100 million affordability fund to help Ontarians who don't qualify for low-income conservation programs ease the burden of their electricity bill. Whether you rent or own your home, as long as you pay your electric bill, you could qualify. There are 3 levels of support available. The first is a home energy kit with upgrades like smart power bars and LED light bulbs. The second includes Energy Star appliances that help keep things cool during the hot summer months. The third is for electrically heated homes so that your power bills don't break the bank during those long Canadian winters. Plus, all upgrades, including installation, are completely free of charge. Visit affordabilityfund.org or call 1-855-494-FUND to find out if you qualify.
Welcome back to On Point. As I mentioned in the opening, we're live on Facebook, we're live on TV, and it gives me great pleasure to welcome a lady that's been doing health and safety for a while. She knows her subject, and before the show we even talked about the fact that when I was in the workplace, I came to twice to get her amazing training. Louise Tet, welcome to your first appearance on Point.
Thank you very much. Good morning.
Good morning. You're the health and safety queen. You know all about it. So tell me, your background, how did you get into the training business? After you mentioned that you were a nurse and you felt you needed to help in another way in the workplace.
Exactly. So I was working before. I went away to go to school and then came back to Sault Ste. Marie, and there were no jobs, so basically I made my own job. I had done some workplace initiatives when I was working in public health, and so this was another foray into public health with another community being workplace. So that's how I ended up doing health and safety, and had to learn a whole bunch more stuff, some legislation, but it really built on my nursing skills.
You mentioned, we were talking before the show, that nursing is a very tough profession. People don't realize how tough it is.
It can be, certainly, and in healthcare we're seeing a lot of focus on violence and harassment in the workplace, and so healthcare from all facets, social services, it's really tough to be the caregiver and still set boundaries in terms of nonviolent and non-harassment in those workplaces. So it's a struggle for the people providing services. It's a struggle for management as well.
When you decided to make the switch back into the training and help people that way, were there issues in the workplace already back then?
Absolutely. This it's not new. These issues have always been there. A lot of my business is based in legislation. So for the most part, I deal with provincial workplaces, but also with federal workplaces. And so there are a set of rules, and there are those rules get enforced. And so a big part of my job is working with the workplaces to make sure that they're in compliance with the regulatory officials.
Right. Well, let's talk about a couple of issues that are important and are causing some issues in the workplace: cannabis and opioid crisis. What are you seeing from your perspective? These things are becoming, in 2019, they're becoming an issue where they weren't maybe as much 20 years ago.
Cannabis isn't new. It's been around forever. I think what's happening in workplaces with the legislation is it's forcing us to talk about it.
Right.
Cannabis has certainly changed in terms of strength. We may be in for a big surprise with edibles that are legal now, but we're not going to see them on the market until maybe the end of the year or into early 2020, because you can't see them. My concern is any of the after effects when people are working in safety sensitive positions. So I'm much more concerned when it's in manufacturing, when it's mining, versus an office job. So, I mean, an office job, someone falls asleep, well, big deal, but when you're operating heavy equipment, it's a huge deal. So those are the concerns, and it's not that it's new to the workplace. Certainly the strength of cannabis has changed over the years. That, if you will, is new, but the use is not new. It's forcing employers to have the conversation. And anytime I have that conversation, the opioid conversation comes into play as well.
Yeah, well, exactly. I wouldn't want to fly on a plane if my pilot's been smoking cannabis. So you're right. There's certain sensitive jobs that you just can't envision that. So what are you hearing from employees? Are they nervous about the fact that it's legal in this country now?
Not really. I think some of the things I'm hearing is that it is same. Some are surprised with some of the expectations, say, from Ministry of Transportation. When you have various licenses, you have to have 0 if you were ever tested in your bloodstream. The employees need that information. Supervisors are nervous in terms of, I don't want to wrongly accuse somebody, but my message is always focus on the work. So if somebody is working differently, if they maybe, they have a smell or they're stumbling, or it could be a drug use, it could be that somebody has a medical condition. So either way, there's a concern that to you as a supervisor, and have a conversation. We don't accuse people. We say, look, I noticed that you're slow, or you stumbled when you came out of the cab of the truck. Is everything okay? And that starts the conversation.
Oh, okay. You kind of lead it in that direction.
Exactly.
It's all about the person and their health.
Exactly. That's right.
And now in your courses, I'm just wondering, there was an example a couple of weeks ago where an airplane had to reroute to Seattle, Washington, and people were en route to Vancouver. The fact that cannabis is legal here, but it isn't in the United States. Do you mention that to people that, hey, you could get into trouble with this? Sure.
You see it at the airports. They tell you you can't cross international borders. So absolutely, it's from here to Michigan, even though it's legal in both areas, but federally in the U.S. it's still illegal. So yes, that does come up in conversation. So it's information sharing, and so people need to understand what the rules are and what the implications could be at work versus on a Friday night at a bonfire. Very different.
Well, that was a weird situation on the plane. They literally told people, look, you need to flush it, you need to get rid of it, because once they land in Washington State, it's a different ballgame.
Yeah, that would be unusual.
And people need to realize that these situations can always happen.
Absolutely. Yeah.
The opioid crisis affects us in the workplace. There's panels talk to me about the panels, and there needs to be real discussion on this because it's not going to change anytime soon.
Exactly. So I was very fortunate to be able to moderate a panel at a safety conference here in Sault Ste. Marie in May, and I just did the same thing at Forum North in Thunder Bay. And we had an excellent group on both panels, and it was a conversation. It was me asking questions, and we had various people in Thunder Bay. We had the EMS there, very qualified and compassionate people that are dealing one-on-one. And the message to us at work is to be sensitive, to not use stigmatizing language, to talk to people and to get people the help that they need and not turn a blind eye.
Right. Was the problem equally as serious here versus Thunder Bay? It's
Yes.
an issue in Northern Ontario.
It is. So they have very similar statistics to what we're facing here in Sault Ste. Marie.
What's your feeling, Louise? Should the government come into play with this more than they are, or is it not government's responsibility to deal with social issues as much?
I think it's all of our responsibilities. So if we look at, it's our responsibility in our families to have those conversations. So that's one area. It's our responsibility at work to treat people fairly and justly and kindly and show a real concern.
Right.
It could be us, it could be our kids. There are no boundaries, and so of course government has a role to play. We all have a role to play.
I guess again, the difference in government in the political spectrum, certain government parties are going to come into these social issues more than others, kind of thing. They put that more as a priority.
Absolutely, yeah.
Now, fit for work policies related to cannabis and opioids, how do those fall into the big picture of getting the education out to people?
So the expectation is that we go to work fit to do our jobs.
Right.
So whether that be if you've been up all night and with a sick child or a sick parent in Emerge and you're a bus driver, you probably aren't fit to be
Right.
carrying, those 40 kids. And so you need to say, I can't come into work today.
Right.
And so it's not only about the drugs, it's about having knee surgery, and now you have to take prescribed Tylenol 3s. You take,
Right.
yeah, all of those things. We all need to come to work and be able to do our job safely.
Exactly. Louise, stay right there. We'll take a couple of commercial breaks and we'll be right back with more On Point right after these messages. Welcome back to On Point for Monday, November 18th. I'm Andy Martins, and we're live on TV. We're live on Facebook. We're having a delightful conversation with Louise Kaiko-Tet about health and safety in the workplace. And welcome back to the show, Louise.
Thank you.
Do you think these companies are aware of the seriousness? And if you could frame the way we're talking in 2019, how do you see these problems in 10 years? Will we get a handle on them, or will the problems of what we're seeing, cannabis and opioid crisis, will they escalate in the next 10 years?
I'm hoping not. I'm the eternal optimist. I'm hoping that in 10 years we're going to get a handle on things. But certainly both of the panels indicated that nothing's going to happen quickly, so in the short term it's still going to be an issue. But the bottom line and the underlying concern are mental health issues. So that's very important that we manage mental health personally, again, in our families and in workplaces. So that's what we have to really work on, and then the rest will hopefully change.
Let's talk about the mental health, because whether people like it or not, it does come into the workplace. And we were talking before the broadcast about that, and I'm sure you see it every day where companies have these issues that they need to deal with.
Sure. So we could all, at one point in our lives, have challenges. Life is complicated. Children and families and underlying mental health issues, conditions, and so it's important that we deal with that. I see the workplace as a microcosm of society, and so it's happening at work. The great thing about a lot of workplaces is they have peer support groups, they have EAP programs, so employee assistance and family programs, and so they're there. Sometimes we're shy to seek them out. So it's very important that we support one another in the workplace so that we can manage any of the right. challenges that we have and deal with those in healthy ways.
I agree with you. I think in 2019 the family is stressed with the breaking up of families, and with the fact that Ontario's the highest tax province in Canada. People are pushed to the limit more today than they ever have been.
Yeah. We have lots of issues for sure. It's how we manage them that's really important, and sometimes we need a little support, and we've got some great mental health individuals and supports, and reaching out is very important. Sometimes it's just reaching out to a trusted friend, a trusted coworker, and so when the workplaces have those formalized systems, people know where to go.
Do you, in the area of mental health, when you see these issues, do you work with other agencies that come in to possibly help these people further? You redirect them to these agencies?
At both conferences, the individuals that were on the panel had a real focus on what services are available in the community, and so those are available to workplaces. So that would be the best way. I don't specifically do that sort of work, but I can very much so point people in the right direction. Where
that's
they can
what I meant,
help.
in case anybody asks.
Yes.
You know the resources that are available for people, and it does exist. I mean, people getting laid off, the call centers in Sault Ste. Marie. And what about injured workers getting people back to work? That's a big piece of what you do as well, isn't it?
It is. So I might not deal with those individuals directly, but certainly workplaces will consult with me in how to get people back to work efficiently, quickly. There's a big cost for workplaces when workers are away, but from my perspective, the best place to be is at work. So the healthiest people work. And so we need to get people back. We need to help them get back in a safe manner, and we need to encourage the co-workers and help them understand that yes, you might be pulling up a bit more than you normally do, but next month it could be you, and so we're a workplace family, and we all have to support one another in that.
And it's always not a physical worker injury, as we were talking. It could be multifaceted reasons why people are off work.
That's
so
right.
It's not always a broken leg or something, but what about train the trainer? You've been involved with that too. Talk to me a little bit about how important that is.
Yes, so the employer has an obligation legally to provide information, instruction, and supervision to a worker, and supervisors also have a big responsibility to train on the hazards, and we need to equip the supervisors with how to do that. So I train for a living. Most good part of my job is training, and so what I do is I go into the workplace and I teach the supervisors how to do that. So I give them a little bit of a view inside of my tricks and tips of the trade, and they get an understanding of how to teach, and they practice. It's a fun course, and they go away learning a lot.
So this is mandated by the government. Companies really don't have a choice with this?
Indirectly, it's mandated. That they don't have a choice to provide training and supervision and identify hazards and teach about hazards. They certainly don't have to take a train the trainer course, but it's a good way to bridge that gap so that they have the skills.
I remember a couple of years ago or whatever, if companies don't follow the proper procedures, they can be fined fairly heavily if people get injured at the workplace as a result of the employer's neglect.
Yes, absolutely. So the fines have recently really increased. So it used to be $25,000 provincially for an individual, and it's now gone up to $100,000, and that's plus a 25% victim surcharge. And for workplaces, it went from $500,000 to $1.5 million plus 25% victim surcharge. Never mind lawyer fees and downtime and investigation time and all of that. But it changes people forever. I've talked to people that have been there when someone has been injured. It changes companies. We need to prevent them,
right.
regardless of the fines.
And then it gets challenging, doesn't it, when you deal with a big, let's take an example of a hospital, where you have to coordinate so many people, and it gets challenging the bigger your workplace is.
That's right. So the large workplaces especially will benefit from managed systems. So so many things have to happen. You have to understand the risks. You have to do workplace inspections. Your Joint Health and Safety Committee needs to be functioning. But you have to manage that. So if you're doing inspections, there are going to be action items. Other people need to know to fix something, to order something, and then how do you ever know that it ever gets done? So in the world of technology, it's gotten so much easier, but that's another big jump for employers, especially some of the smaller ones, but the efficiency is amazing. So when you're managing the health and safety, it's much easier for the large corporations.
Exactly, and people say, well, how can somebody get hurt? But it can be as simple as leaving a filer box in the wrong place and somebody tripping over that box. Yeah. I mean, it doesn't take a lot when you're coordinating hundreds of people to follow health and safety procedures.
Exactly.
What about leadership in the OHS, Louise? Talk to me about how important that is.
I can't overstate how important leadership for health and safety is in an organization. So if I'm doing training, I'm having meetings with frontline staff, with supervisors, I look around, and when the CEO, the executive director, is sitting in there as well, it speaks volumes.
Right.
When they're sending out newsletters and they're including safety, when safety is part of every management meeting. So it's not something that happens only in the safety department or only at the Joint Health and Safety Committee once every 3 months. It's an integral part of the entire organization. Those organizations are extremely successful.
But you find, though, in an important organization, people are motivated to carry out the health and safety procedures at different levels. And that's probably your biggest challenge, to motivate everybody to get onto the same level.
Sometimes those motivators are indirectly affected by budgets, by time. If you're on a project, for example, and you're getting an extra $50,000 to be done by a certain date, then time becomes what motivates you because you want the bonus. And so we have to look at what is the motivating factor. When you've got a leader that says, we get it done safely, that's first and foremost, and we're not about getting the bonuses and the extra money, and we do it safely first, that goes a long way. So sometimes there are other things that get in the way of the real message.
And everybody's really different. Each company has different levels and messages that get across.
Absolutely. The most successful companies in terms of health and safety and environment as well security is when the CEO is front and center, and it's not just they're not just playing lip service, but they're actually out there and they're meeting with people, they're doing work observations, they know what their staff is doing, and they're truly listening and making changes. And sometimes those changes have to cost money.
Louise, it's been a thrill. I'm out of time. Thank you so much for coming. The show just flew away on us.
Great. Thanks for having me.
Thanks so much. I'll be back to wrap up the show right after these messages.
This is On TV.
In your home, lighting is just as important as style.
With PowerView Motorization from Hunter Douglas, you can schedule your shades to light up the room, create privacy, or both, automatically. No hands required.
So your shades will always be in the right place at the right time in style. And it's only from Hunter Douglas.
Welcome back to On Point. We hope you enjoyed that show with Louise Kaiko-Tet. We've been on live on TV and live on Facebook. Tomorrow on this show, Executive Director Dan Hollingsworth makes his first appearance on Point of the EDC. And then next week, Jennifer King-Callan, she's the Director of Tourism, Sault Ste. Marie. A couple of big shows coming up on Point, and we'll see you then. Andy Martins, take care. Have a great day.